Hi, today I'm going to talk about something that's cropped up a lot in my life over the last few weeks, which is people dealing with serious illnesses. So I've had a number of people in my life just coming up, connecting with me both professionally and personally. So they're really dealing with some stuff that is tough and involves lots of medical care. So whenever these things happen, I always think it's an opportunity to kind of listen to that message and think about it. And I'm making this podcast really to describe some of the things I think might be useful if you're somebody who's going through some health issues in your life, or if at any point you do, and sure enough, in all of our lives, these things happen from time to time, or if you know somebody is, it might be useful pointers. So a couple of things I've been thinking about from experiences that people have told me and books I've read over the years. The first thing is a really interesting audio by Chris Halbum, who's an amazing NLP practitioner in California. There'll be a link you can get hold of this, but if you just search for Chris with a K, Halbum, that's Halbom. And she had the extraordinary experience of going to the doctor, just not feeling very well, and suddenly coming up with a really, really serious diagnosis of stage 4 cancer, which is pretty much an end game. When people start talking about stage 4 cancer, you're usually talking about how many months they have left to live. So this is a massive shock to her, and she talks about her journey on how she managed it, and how, although when they diagnosed it and they did all the scans, they were very clear that this was a serious thing that was pretty much life-ending. When they came to do the operation, they found out that it had completely changed from when the scans had been done as a result of the work that she had done on herself. And she describes what the main approaches she used were in her audio, so get hold of that. But I'll tell you some of the things I think are particularly interesting about it. One of the things she said, she met the oncologist, and she said, so what's going to happen? And the oncologist went through all the potential outcomes that could occur. And right at the end, Chris said, because she'd actually done some work before she went to see the oncologist, she said, so okay, I get those are the likely outcomes and then the worst case scenarios, but what's the best case scenario? And the oncologist was kind of surprised by that question, because it's not something they think about very often. It's probably not a question they're asked very often. And she sat for a bit thinking about what the best case scenario was, and it took her a while. We said, we did have somebody once who, when we went in and we found out that actually the cancer hadn't spread, it was benign, it was contained, and it was easy to remove. And so Chris said, well, let's head towards that then. Let's find out how we make that happen. And they did lots of work, her and her husband, Tim, who's also an NLP master, on what might make a difference to make the biggest chance of that outcome to come. I still had the surgery, so it's not about ignoring medical advice, but it's about thinking, what part do I have to play? What can I do to possibly make a difference? She also talks about how her brother had something similar, a very serious cancer diagnosis, and the way he talked about it was he decided to fight it. He was going to do everything he could to kill this, to beat it. And you often hear this language, this quite conflictual language in health. We're going to destroy, we're going to bombard, we're going to nuke, we're going to remove, we're going to excise, we're going to rip it out, we're going to beat it, we're going to destroy it. And these kind of conflictual words, there is some schools of thought that say actually we need to move towards a very different model. That what if instead we saw this illness as some communication from our body, and that first of all what we need to do is to make friends with it, to really understand it. And Chris says, I spent a lot of time really making friends with this part of me, really trying to understand what message it might have to give me. And certainly a lot of work that I do around helping people to recover from injury and illness, so one of the key things is bringing a kindness and compassion, because healing is about generating wholeness. It has the same Greek word, so it's how do we find a way to be okay with this and move this forwards. The other thing that Chris talks about, which I think is quite interesting, is she renamed it. She was given this name, which was called something like a large abdominal mass, and she says, I didn't really like that name, and I thought it probably doesn't like it too, so I changed the name. To, I think she called it My Remarkable Healing Part. But think about your body is listening all the time. What are the words that we're carrying around to describe bits of us that don't work well? From that bad leg, or that difficult area, or that damaged. And quite often you hear the patients will talk about this. They'll say, my good arm and my bad arm. So they're kind of already describing it in a way that's not very useful. And the body and the brain are always listening. So maybe think about what would be an inspiring terminology or name to call this bit of you that isn't currently working the way you want it to work. The other thing I read years ago, which I always think about, is a book by Brandon Bay. She talks in her book The Journey, where again she had cancer. I think she had an ovarian mass, but it certainly was an abdominal mass. And she told the story how she went to see the oncologist, and they said, look, we've got this thing here, it's about the size of a grapefruit, and it's pretty difficult, and you need to get this removed. And she felt pretty knocked over, as you do when these things happen. And then she went to her office, and she happened to work with Tony Robbins, who is an NLP kind of expert and motivational speaker. And he said to her, I know you've got this, you can sort this out. If anyone can sort this out, you can sort this out. And she noticed when she spoke to Tony and the rest of the people at work, she felt quite positive and optimistic, and I probably can sort this out. She went back to the doctor, and the doctor said, yeah, these things don't go away, we really need to get in there, this is difficult, this problem. Again, her mood just flattened. And when she went back to work, people said, look, there's lots of stuff you can do, I'm sure you can work with it and see what you can achieve, to give her some sense of power in the situation. She thought, I probably can, maybe, of course I'll take my medical advice, but, I think there's things I can do. And she noticed how her mood massively shifted depending on who she was talking to. And what she did was very interesting. She decided she would only tell people about her issues, her illness, if she knew that they were the kind of people who would be optimistic and support her recovery. So if somebody was going to, go, I had somebody who had that and they didn't recover, she just decided, right, those are not the people I'm going to share this information with. I want to share it. It's important. There is some evidence, of course, that talking to other people about your stuff is very, very empowering. I've told the story before about the two mice in the cage, that when one mice is in a cage and he's not well treated, his hair falls out, but he's got a friend with him to chat in mouse conversation, then both mice survive better by having the company of another mouse. In the same here, it's good to talk, but it's what conversations are we having about it. So she decided just to tell people who had a positive attitude to, this is something that you'll learn from, or you'll move forwards from. So there's some interesting ideas about what are we calling it, what are we saying, how are we relating to it, who are we telling about these issues. And then finally, the last thing is, in NLP there are some interesting ways of thinking about things called presuppositions, which if you've listened to some of my NLP podcasts, you'll know about the NLP presuppositions, which are statements that are considered to be guidelines. They're saying these are not true, but let's imagine if we saw the world in this light, what would the world be like? So we're not saying they're absolutely true, but there might be an interesting way to engage and relate to the world. And one of the NLP presuppositions is, what if we said, if somebody can do something, somebody can achieve something, then maybe I could replicate some of that success. So somebody can do something, then it's doable. All I need to do is work out how they did it so I can reproduce that. If we take health as an issue, if somebody has already had the illness and issue that you've had, and they have recovered, it means there is a route through this. They found that route. So there may be a possible route through that you can find too. What we need to do is work, how did that happen? What occurred? What occurred for them to move from ill to well? And the other thing which, if you're interested in this kind of stuff, is central to my work is the use of the word do. With the do, we've got this idea that instead of things happening to us, we have an active role in it. So instead of being angry, we would say we are doing angry, that at some level we are the ones creating the anger. Although other people may help us, they may invite us to get angry, it's still fundamentally us that's doing the anger, that's creating the anger. And the do has this U and a little circumflex instead of an O, because we're not doing it on purpose. Very often these are unconscious behaviors we just happen to be doing. So instead of saying I am stressed, we'd say I'm doing stress. But we can actually take it into medicine, into health, because actually instead of saying I have an infection, which is shorthand for lots of physical activities going on inside of your body, including your immune system, your white blood cells, lots of chemicals being produced in hormones. Instead of saying all that, we just use the shorthand that I have an infection or I have inflammation. But actually it's more accurate to say I am doing infection or I am doing inflammation. And again, it's with a U, you're not doing it on purpose, but it is your body that's doing that. And if it's your body that's doing that, then it gives us the opportunity to go, well, if this is my body, if this is a process within my body, I wonder what I can do to influence the outcome of that. How can I stimulate better immune system function, get those cells working better? And there's lots of evidence that we can actually have an effect on this, not just me saying that. There's lots of research that says your immune system, your white blood cells are very much affected by your mood, your diet, how much you exercise, all sorts of stuff. There's also some very clear evidence that if you remember happy memories, it changes the way your body deals with stress, changes the way your body responds to threat, changes your immune system function. Long-term meditators, for instance, have a changed immune system in a positive way. So instead of saying I have cancer, I have a fracture, we should say I'm doing it. And it's actually more appropriate and a more accurate way of describing what's going on. But also it gives us a little bit of a sense of, well, then I have some way of saying then maybe there's some things I could do that might positively influence the outcome. And that's really important, because otherwise we have to put ourselves in this position where it feels like there's nothing we can do about it. And that in itself produces another level of threat, this sense of being powerless, which we all feel when somebody's making decisions or conclusions about our health. And regaining that sense of some sense of power, some sense of influence is very, very, very important in recovery. In fact, the word patient and the word passive, powerlessness, are the same, have the same Latin root. So regaining some sense of influence and power. Now, again, we have to distinguish. It's not saying you're to blame for your illness. It's saying, no, that's not the question. It's not what we're talking about. What we're saying is, I wonder what influence we can have on moving things forwards. Whether that's, improving our sleep, improving our diet, improving the amount of water we drink, running faster, exercising more, meditating more, relaxing more, hanging out with friends more, drinking less. All these things are things we can influence. And of course, changing our internal chemistry by where are we putting our brain, what patterns are we triggering that are positive or not so positive. And all these things give us a chance to make some difference to things that are really important. I mean, I, like you, I'm sure, when you're not well, it's horrible. I really don't like it. So anything we can do to shift that and move ourselves forwards in a way that allows us to learn and is kind to ourselves would be a really valuable thing to do. So there's some thoughts for you guys. I hope that's useful for you at this point in your life or at some point in the future as you move through the things that come into our lives from time to time. You take care now. Bye.